This is Caitlin Smith, age 21, a female, who was just admitted to the ortho floor via the ED with multiple fractures. The injuries were sustained during a ski accident at the local ski resort. She is currently alert and oriented ×4. Her vitals are as follows: blood pressure 165/92, respiratory 24, oxygen saturation 92%, temperature 99.2. She reports her pain level to be at an 8 or 9. She has left the AC. Emergency department nurse reported to have administered 5 milligrams of morphine, an initial adult dose, an hour ago. The patient's sister, Jessica, was with her during the accident and has followed her up from the ED to the ortho floor. The recommendation from the ED nurse in handoff report was to follow up with the hospitalist for an increased dose of morphine.
Hello? What are you doing? Can't you see she's in a lot of pain?
All right, we hear your concerns. It's okay. Let's finish assessing her, and then we'll see what we can
Well, I
get
don't
her
know.
for
The
pain.
emergency department gave her something and it's not working. So
Okay.
why are we still, you're touching her, let's just give her pain meds.
I know. Sarah, can you assess Kate's pain, and we can see if we can get her something more?
Right. Okay. So I know you're not in the pain, but I'm going to ask you some questions specifically about it. So, can you tell me where's the worst of the pain? Where are you feeling the most of your
I'm
pain?
writing a bad review on you guys.
I'm just feeling it everywhere.
Everywhere. Okay. And would you use any specific words to describe it, like the character with radiating, stabbing,
Maybe both.
both of them? I'm sorry. And if there's anything you've done since you've been in the hospital that's made it any better or worse?
No, nothing.
Obviously nothing has made it better. Why, are you still asking her questions right now?
I am. I'm sorry. I just have to. I know you're upset. I just have to ask her one more question. You can look at the pictures, or you can tell me on a scale of 1 to 10. Where would you rate your pain?
This
Right
hospital's
now.
getting a 0
Probably
out
an
of 10.
8 or 9.
Okay. All right. Listen, we are gonna. I promise you, we're gonna get something for your pain. We're gonna get this under control.
Okay.
So I just received Caitlin Smith. She's a 21-year-old female with multiple fractures from a ski accident. We got her from the ED. She was given 5 milligrams of morphine an hour ago, but she's reporting her pain to be at an 8 or 9. I just want to know, what can you order to help get her pain under control? She's really hurting.
Sure, Sarah. So I just reviewed her lab results, and her BUN and creatinine levels are elevated. So giving her morphine is contraindicated at this point. Let's see, I'm going to switch her to Dilaudid. It's 7 times more potent than morphine, and it's safer in her case with renal insufficiency. So, okay, I just put in the initial order for 0.6 milligrams IV. I'll be up to check on her shortly.
Okay, thank you.
Bye.
So the doc just said that we're supposed to give her 0.6 milligrams Dilaudid IV, and said something about we can't give her morphine anymore because she has renal deficiency. So what do we do next?
So what we're gonna do is we're gonna double check the order in the computer, and before we head in to get her medication, let's make sure that we've covered our 5 rights of medication. So we're gonna make sure that we've got the right drug, right dose, right time, right route, and right patient. And also, while we're back there, let's check that med book, because we're going to want to make sure we have our education pieces down before the sister starts to ask.
That's funny. Well, thanks for reminding me all that stuff, because Lisa Guthrie, my farm teacher, she was always dialing that stuff into me. Okay, so I'm drawing up 0.6 milligrams Dilaudid, right?
Correct.
Okay, so I've got the right drug. I'm gonna get the right dose. Route is gonna be IV. I need to get this connected here. Patient, we'll check that in the room. Put that in there. That 0.6. I'm gonna check from there. 6. Okay, does that look right?
Yeah, it looks great.
Okay, perfect. I'll make sure to scoop that up. So, drug, dose, we'll document when we're done, patient, route, time, right now. All right, good?
Yeah, it looks like I've got some education pieces here for the sister in case she comes after us. She's a little spicy, and we're ready.
Okay. Okay, Caitlin, so I got a stronger medication for you that should take care of your pain. It's Dilaudid. But I need to get two patient identifiers. Could you please state your full name and birthday for me?
Really? You don't know her name yet? How many bad reviews can one person write in one day? Come on.
Jessica, is it my turn to answer yet?
It's okay.
Whatever.
We use two patient identifiers as a safety caution here. So we always do it when we're using different procedures or administering medication. We always want to make sure we're getting name and date of birth, and we would check it against your barcode here, and it looks like she's good. So she's going to go ahead and start to administer out of Dilaudid, okay?
Okay, I'm going to administer this medication over the course of probably 2 to 3 minutes, nice and slow. And I want you to tell me if you feel any changes in sensation or any pain at the IV site, okay?
Okay.
How are you feeling? Are you feeling anxious at all?
Yeah, actually, I'm feeling really nervous. Do you think I could have my Xanax?
Yeah, could you just do something?
Actually, we can't give you your Xanax right now.
Of course.
Your Xanax is a benzo, and we're giving you an opiate, and together they could cause some respiratory depression and make it a little hard for you to breathe. Is there other things we can do to help with your anxiety?
Wow, is this a real doctor? Wow, I didn't know they existed in this hospital. It's getting better all the time.
Must be your reviews.
I bet
Finally
it is.
starting to come through.
Hey, this is Dr. Martinez. She wanted to stop in and talk to you about your medication and do a little pain reassessment.
Hello.
Hi, Kate. I'm Dr. Martinez. How are you doing? I hear you've had
Does
quite
everybody
an
have to
accident.
be in here all the time? Really?
I'm sorry, as a nurse, I was hanging out to be a kind of an advocate for our patient here.
Jessica, I'm Dr. Martinez. If there's anything I can do to enhance your stay, please let me know.
Okay.
So I hear you've had quite an accident.
Yes.
How are you feeling after your first dose of Dilaudid?
Finally, I'm starting to feel better. I'd say my pain's at about a 1 now.
That's great progress. From an 8 or a 9 to a 1. Is it okay if I sit next to you so I can listen to your heart and lungs for a minute?
I mean, she's broken, but go ahead.
Okay, I'll just stand. Alright, so I know you want to stay on top of your pain.
Yes. When will I be receiving my next dose? I'm going to set an alarm to make sure I get it on time.
Sure. So going forward, we can administer that dose of Dilaudid every 2 to 3 hours as needed to get your pain under control. I can also increase that dose a bit if that's not quite cutting it, and as as your pain starts to go up. So with this type of injury, you're going to need to control your pain for a while. After we've established an opioid tolerance, my goal is to switch you maybe to a fentanyl patch.
Aren't fentanyl patches like bad for you or something?
Well, the nice thing about a patch is it's continual around-the-clock pain management, and you only have to change it out about every 72 hours. So there's definitely some things you'll need to know about application and disposal, but we can go over all that education before we switch you over.
Is there other things we can do to help with your anxiety?
America, we do meds.
I'm so sorry. I could not stop laughing.
I've been putting Dilaudid for days.
That was the end of the scene.
No.
Her boobs are out.
I know.
Ow.
Stop.